I'm Jill Webb from Jill Webb Training. One of the sets of courses I offer are first aid courses, and I'm going to show you today how to deal with a choking casualty. Choking is very, very common. We've probably all seen somebody choke, but the first aid can be incredibly effective. The way that we deal with choking is the same for an adult or a child. It's different for a baby. So we're thinking here of sort of children from age 1 right through to adults. And I'm going to demonstrate this today on an adult, but I will talk you through the differences on a child. So if an adult presents as choking, the first thing I need to do is decide whether it's a mild or a severe choke. And to do that, I see, can they talk to me? Hi there, you're right, can you speak? So that would indicate that the whole airway is blocked. If it had been a minor choke, which many of us have had, you would cough it up, come on, keep coughing, and then hopefully they would settle down, maybe give a sip or two of water. We've probably all dealt with that. But today we're going to think now about a bit more of a severe choking episode. So the airway is blocked, the person's not able to respond. Don't forget, for an adult, it is very good practice to always check that the adult wants help. For an unconscious casualty, consent is implied if we give first aid. So, you look like you're choking yet? Do you want me to help you? Okay, so, think about danger to yourself, seems fine to approach. I'm going to approach my casualty, and the first thing I'm going to do is I'm going to apply 5 back slaps. I'm going to put my hand in front of the casualty and I'm going to say to the casualty, put your arms across the chest like this. And then I'm going to put my hand there in case the casualty falls. I'm then feeling for the casualty's shoulder blades. I'm taking the palm of my hand and I'm giving 5 hard smacks between the shoulder blades. 1, 2, 3, 4, 5. You can see that every time I'm looking on the floor to see whether whatever they're choking on's come out. So 5 back slaps, they haven't worked. We're going to move on to abdominal thrusts. So I'm going to stand my casualty up and I'm going to demonstrate this before I demonstrate it on my casualty. So when we think about abdominal thrust, this is what you need to do. Take your dominant hand, so I'm right-handed, and put it up as a fist. Cover your fist with your other hand, and directly in front of you, you will be able to see your knuckle. That's what you're trying to use to do an abdominal thrust. And what you're thinking of is about halfway between where you would do CPR on an adult and their tummy button. And if you try it on yourself, please only try it very gently on yourself. You should feel yourself getting slightly winded because your tummy is a bag. And we're trying to push the air out of that bag, back up your windpipe to ping out whatever's in the airway. Have a go at that. So now I'm going to demonstrate those on my casualty. So I'm going to take this hand, if you remember, and cover it like that. Round one side of my casualty, round the other. And I'm going to aim for about halfway between the tummy button and where I do CPR. And I'm going to do 5 backward ticks. Obviously, I'm only simulating this because you could actually hurt somebody. And now the obstructions come out and the casualty can breathe. I'm still going to say to the casualty they need to get checked out of hospital. And the reason for that is an abdominal thrust might have caused internal injury that I don't know about. Thank you very much to my casualty. I'm just going to add a few more bits and pieces now that might be useful. So you might have thought, I've never heard of that first aid before, crossing the arms. Actually, that was a really good tip given to me by another first aider. 2 reasons for doing it. The first reason is somebody who's choking will be panicking and they might be doing this and think about your safety. They'll clout you, not meaning to, but because they're in a bit of a state. So doing that gets their arms out of the way. So the second reason for doing this, particularly if you are working with a young woman or an adult woman, is the fact that you are protecting yourself from any allegations so that you're able to say, keep yourself safe and I will do my best to help you. So that's the first thing. The second thing is, I was fortunate enough today to have a casualty that was fairly slim and I could get my arms round. But actually, quite often, you might face the issue where you can't get your arms around a casualty because they're quite big. And we do want to get enough leverage by getting around them to get those backward ticks in. So what you might need to do is think of another way to do it. You could stand the casualty against the wall, and then you could do the backward ticks like that. You could lie them on the floor. I've even seen it done really effectively with two people. So the casualty's in the middle, we hold hands behind them, and we make the abdominal thrust together. So there are variations that can be done. Always, as in first aid, focus on what am I trying to do. I'm trying to get as much air expelled out of the tummy as I can. If someone's in a wheelchair, you need to tip them out of the wheelchair and you need to get them on the floor because you need a solid surface behind you. A wheelchair won't be a solid enough surface. Then the other thing to mention is children. Obviously, smacking their back needs to be in proportion to the size, but it does need to be a good hard slap. So we're straight away going to be thinking about things like the safeguarding agenda. If they're children we're looking after, we're going to be keeping notes of what's happened and recording it as a safeguarding issue. The other thing to think about with younger children is how gravity can help you. So if you're sat down, you can actually put a child across your knee and the smacks, and actually gravity might help you. So it's as always with first aid, you've learned the principles, which is 5 back slaps, 5 thrusts, repeat, repeat, repeat. Adapt them in the situation you find yourself in. Once you're doing your set of back slaps and thrusts, if the casualty is still choking, you continue that cycle of 5 back slaps, 5 thrusts. Eventually, one of two things is going to happen. Hopefully, as happened in the demonstration, the thing they're choking on will come out. We talked about still advising them to get appropriate care. If it doesn't, eventually they're going to collapse, and you're going to have a casualty who's not breathing because their airway's blocked, who's collapsed. And we already know that somebody who's collapsed and not breathing needs CPR. So if you need to refresh yourself on that, go and find the video that updates you about how to do CPR. I hope you found that useful. Thank you.